Welcome and Happy New Year. My name is Renee and I'm the president of the Dearborn Kiwanis Club, which has been the host of Dearborn Kiwanis KiwaniTalk for over 28 years. It's my pleasure to be here tonight with my two co-workers, Josh Crawford, who's actually kind of my boss, and then Tom Sundar, who is our therapist at our office. Josh and Tom are here tonight to talk a little bit about arthritis and how the physical therapy can really help a patient that has arthritis. Josh, why don't you start with a bit about you and what you and Tom do at Dr. Crawford's office? Again, he's actually the doctor's boss, so I'm just really thrilled that Josh and Tom are here to share what a lot of us go through and we don't know what kind of pain we're having. Josh.
Sure. Thank you, Renee. My name's Josh Crawford. Dr. Crawford is actually my dad and my boss as well. He's an orthopedic surgeon, and Tom has been with Dr. Crawford for the last 10 years, providing excellent physical therapy care for many of Dr. Crawford's patients, getting them good recovery after surgery and great results for the patients who are lucky enough not to have to go to surgery. We're going to talk about a lot of subjects today. We're going to talk about arthritis. We're also going to talk about a lot of the newest evidence-based techniques for hands-on therapy and the different types of therapy that can help with all sorts of orthopedic conditions. So with that being said, Tom, if you could tell us a little bit about your background and how long you've been doing physical therapy, and then we'll get into some more questions.
Sure. Hello, my name is Tom. I'm a physical therapist specialized in orthopedic and sports medicine. I've been as a therapist for 29 years. I graduated my bachelor's degree in India. I came to US. I did my postgraduate in Florida. I did several postgraduate studies also. So I've been with Dr. Crawford last 10 years, predominantly treating orthopedic and sports medicine patients. Our clinic, we do mostly manual therapies and evidence-based rehab. We treat varieties of conditions.
I can jump in there. Like you said, we treat many types of orthopedic conditions, including arthritis, but you treat sports injuries and other injuries as well. Let's just start with some of the common conditions that people come to you for. So you treat patients that come to you for back and neck issues, patients that come for shoulder, knee, and hip issues. With regards to the back and the neck and the spine, what would be a common reason that people would come to you for treatment?
Most of our patients that come to our treatment, neck and back pain, shoulders and knees, as well as a hip. Mostly we see a lot of arthritis patients, mostly middle-aged too. As they progress the age, they tend to develop as most arthritis. So we see a lot of post-operative cases in our clinic, focusing on restoring their functions. Mostly we see a lot of shoulders and knee patients.
Okay. How would a patient who currently has shoulder or knee or hip arthritis, what would you recommend as far as the first steps in starting to deal with the pain that's been gathering up over time, and what's the role of physical therapy in dealing with the earlier stages of arthritis?
Well, if the patient has started feeling as immediately as any pain, they should see as a medical doctor, find out where is the pain is coming. If the diagnosis has confirmed is related to osteoarthritis, we encourage the patient to start moving, not to be lying down or not doing any other activity at all. So there is a lot of the study shows that the patient has to start moving. There was less symptoms, less pain, less stiffness on those patients, so they can able to function better. So as a therapist, we try to encourage the patient to move. We give some specific exercises to restore their functions.
Okay. And you take that one step further and make sure that within your physical therapy regimen, you're using a lot of hands-on techniques and mobilization. Is that the same for arthritis patients as well?
Yes, it's also same for the arthritis patient. It's also depend upon how severity of the arthritis. If the patient has comes in acute arthritis, we do very thorough evaluation on see whether the how function limitation they have. So if some of the arthritis patients, they have also limitation on the hip and limitation on their back, limitation on the ankle joints. So we have to thoroughly examine the patients and give them appropriate treatment. Especially in acute stages, we do a lot of active modalities, active treatment we call. Mostly we tend to move the patients if the joint is stiff, and we educate the patient to move the joint. We do various manual therapy technique to mobilize the joint, and also we use some passive modalities to decrease the pain.
Now, with a lot of arthritis patients, the end of the conservative road, conservative being injections, bracing, physical therapy, anti-inflammatories, is going to be eventually surgery on that joint. Can you talk about the role of surgery, and then more importantly, the role of physical therapy after surgery for total joint replacement patients?
Yes, that's very good questions. And physical therapy is very important right after the surgeries. Predominantly, we need to restore their motions. In main, we have to control the swelling. So after the surgery, we educate the patient to walk early. A lot of the study has shows the early movement. Patient has to get up and walk initially. So you have some better function down the road than the patient not doing anything at all. So physical therapists use various treatment. The initial stage of the surgery, we want to control the swelling. That's number one. We use a lymphedema technique, we call orthopedic lymphedema technique, to use to control the swelling, as well as use other modality to decrease the pain and restore the range of motions.
Can you explain that technique a little bit more?
Yeah, most of the patient who undergone, especially on a knee replacement patient, tends to have a lot of the swelling, a lot of the pain. So when the patient feel the pain, there tends to be put some pillows or some other comfort stuff below the knee joint that create more stiffness on the knee joint. We encourage the patient not to do any anything below the knee, tries to keep the knee straight, start to walk immediately. So the lymphedema technique, we use a couple of layers of, 2 layers of foam and 1 layers of stockings, again 2 layers of wrap in a specific technique to control the swelling. So a lot of the study shows that when the swelling has decreased, decrease the pain and improve the range of motions, and also decrease the narcotics.
I think you probably hit on one of the main reasons why physical therapy is so important, because a lot of what you just said is contrary to what the patient actually wants to do. You feel a lot of pain, you want to rest, you want to put your leg up, put a pillow under it, but you're saying you have to walk, you have to use these other techniques, and that's the importance of having it guided by a physical therapist right from the beginning.
Yes.
Yeah. Great. So let's talk a little bit about some of the other types of injuries that you treat, especially sports injuries. We have common sports injuries like rotator cuff tears, ACL tears, Achilles injuries. Some of these need surgical repair, but some of them, especially in the case of a partial tear, you might be able to get a good recovery with just physical therapy. Is that correct?
Yes, that's true. And we see a lot of rotator cuff tear in our clinic. Physical therapy has helped significantly, especially if you have a partial tear, we call. And we restore the glenohumeral joint mobility, we restore the scapular mobility of the shoulder joint using various exercises. For example, if the patient has younger patients come from high school football players or baseball players or volleyball players, we have to give them as a specific exercises so they can go on play again. So we do thorough evaluation of where the patients, how the patient is performing in the sports level, where is their limitation is. There's a muscle imbalance, they have a joint hypomobility, we call. The joint doesn't move as properly. So that's the therapist will come back, examine the patient thoroughly. We do specific technique for the specific patients to restore the functions. Especially, I'm specialized in Mulligan technique. That's a very significant improvement on a shoulder rotator cuff patient. And also we use other passive modality, but mostly exercises, evidence-based exercises, strengthening on the scapula muscle, strengthening of the glenohumeral joint muscle, strengthening of the core and hips. So we just not just treat the shoulders, we have to treat the whole body to restore their full function so they can able to play or able to do all their functional activities or work-related activities.
I want to jump in here for a
Yep.
second because I do have a torn rotator cuff. But as you said, I'm one of those people that I feel if I move my arm up, it's just going to cause me more pain. So I avoid moving my arm because even sitting here right now, it's in pain, but I'm afraid of going to a therapist because I don't want any more pain. So what
Yes,
you
that's-
telling me you're going to help that.
That's true. Absolutely. A lot of the patients come to us. I have a tear over there, so I don't want to move my shoulder joint.
Yeah.
That's not true. If you keep your shoulder joint in protective position, that's going to cause your capsules. We call the capsules on the shoulder joint get inflamed. You get more stiffness. So you're going to lose your functional mobility. So we encourage the patient to have some therapy to restore the joint motions. So the more you're not using your joint, the more stiffness you're going to get.
Yeah.
So we'll give a specific exercise to work on that one. So when you do the exercises, we call this a compression force. We compress the joint. That how can heal your rotator cuff if you have a partial tear. Some patients, they don't need us as surgeries if they do continue to doing exercises.
Well,
Sounds like we might have got you a patient.
yeah, I might have to start.
So that's great, and I think one of the points I want to come back to that you mentioned is the idea of looking at treatment for a specific injury as more of a holistic approach, where you're not just treating, let's say, a knee. You're treating a lot of the surrounding tissues, the muscles right up into the core and the spine sometimes, because that will allow the maximum healing. Is that something you'd say is the best approach?
Yes,
Yeah.
yeah, definitely. We don't, in our clinic, we don't just treat if the patient comes as arthritis on the knee joint. Let's just only treat the knee joint, let's get rid of the pain. No, we want to look at the patients, how they're walking, how they're sitting, how they're moving. We even give them a diet, a specific diet to decrease the inflammation on the joints. So we have to approach on a very holistic approach to heal those patients.
Great.
So I wouldn't be able to drink Coke. Coke's probably not good for my
Well, Coke
arthritis,
is
right?
number one.
Okay.
we definitely don't recommend any sugars.
Sugar, okay.
As you consume more sugar, you create more inflammation, so that cause the other reactions. So you'll have a more stiffness, more pain. So
that's good to know.
yeah.
Yeah, that's good to know.
Yeah, I educate a lot of my patients on proper diet, especially right post-op case. They want to be on a very well-balanced nutrition to have a speedy recovery.
Okay, we got about a minute before we take a break. Do you want to, Josh, again, tell us the phone number if anybody's interested, a website?
Sure.
Where can you be reached?
You can schedule physical therapy with Tom or orthopedic treatment with Dr. Crawford by calling 734-721-8785, or you can go to the internet and go to www.orthocrawford.com and schedule from there.
And we get them in pretty quick. When patients call, we don't want them to be in pain any longer than they have to, so we really get our patients in pretty quick to be treated by Tom or Dr. Crawford. Okay, guys, we're going to take a break for a minute so that you can have a drink of water, and then we'll be right back. Welcome back. I'm here tonight with Josh and Tom, who are my co-workers, and we've been talking about arthritis and physical therapy and how the two play a great, especially physical therapy, how it plays an important part of anyone who might have arthritis. And so I'd like to welcome back Josh and Tom, and they're going to tell you a little bit more about how those two interact. Josh.
Thank you, Renee. So we left off, we had talked about some of the joint issues, some of the sports injuries. One thing we hadn't talked about yet was the spine, and arthritis affects the spine regularly, the neck and the mid and low back. And then there's other injuries or conditions with the spine, and many of those can be treated by therapy. So Tom, if you maybe want to start with arthritis of the spine and what the causes and treatment for that is.
The back pain is the second most common people go see a doctors. The first one is a common cold, second is a back pain. So there's various causes can has a back pain. It's one of them as arthritis. As we age, our spine can get deteriorate. We call them as a disc. Disc can be get as a brittle. It cannot take any compression force. So that will gradually lead to arthritis or disc herniations or spinal stenosis, because where there's a foramen is get a lot of arthritis. Is cause that inflammation. The inflammation causes swelling. The swelling can cause a compression of the nerve. Patients have a back pain as well as a leg pain. A lot of the study shows that people who do a lot of the driving activity, the vibrations, constant vibration can cause that the disc can be get inflamed, and we call degenerative disc disease. That cause another repetitive movement, especially doing any heavy lifting activities, can cause arthritis changes happening in your spine, especially if you put a lot of stress on the disc.
And what would a patient who comes to you with long-standing back pain, who has arthritis in the spine, what would a physical therapy regimen look like for that patient?
If the patient comes as you have a degenerative disc disease or facet joint arthropathy, we call generalized low back pain. Most of the patients comes with a degenerative disc disease as we age. So we thoroughly examine those patients. Most of the patients will have a muscle weakness, especially we call it a core muscle weakness. The weakness on the abdominal muscle, weakness on the spinal muscle, weakness on the hip muscles. They have a poor postures. Even the feet as misaligned, the hip as misaligned, hip rotation. They don't have proper mobility on the hip joint. So they've been walking or doing all the functional activities in improper way. That put a lot of other stress on the joint as well as the muscle imbalance. So we examine those patients very thoroughly, so where the patient is, where the limitation is of the joint and the muscle imbalance, and then we give them a specific exercise to do, and then we do the specific spinal manipulations, spinal mobilizations, evidence-based exercises to eliminate their pain as well as to restore their functions.
There's so many times we hear stories all the time about patients who have, they may think that they have pain in their hip or even in their knee, and once you really get your hands on them and examine them, you realize that maybe it is coming more from the back or the spine, or maybe it is a combination of changing the way they're walking or sitting or laying that's leading to those things. So the issue might be coming out of the back. So that would be one of the important reasons to see a physical therapist.
Yes, yeah, that's true. When that's the main reason that we examine the patients where the pain is. The patient is coming from the knee joint. The knee joint pain could be from your spine. So you may have a degenerative disc disease, the inflammation causing the nerve to be compressed, causing the pain. We call radicular symptoms. So any patient come to our clinic with the knee and hip and lower extremity, we thoroughly examine the patient on the lumbar region. We want to rule out, make sure it's not coming from, if the knee pain is not coming from the back. If it's the back, so we know which segment is affecting.
You've worked with Dr. Crawford for 10 years, and one of the things that's so important is the good communication between the therapist and the surgeon. And in the current medical climate, you don't always get that good communication. But can you talk about how you and Dr. Crawford might handle a patient who who is in a stage where it's uncertain whether surgery is necessary?
Yeah, it is a good thing to work with Dr. Crawford. I'm very close to his building, so I can access him very easily. I can access the patient record, access their MRIs and other x-rays. So before we do any treatment, if there's any red flag, we call red flag, yellow flag, we immediately discuss with Dr. Crawford. He is very profound on communications. We need to have a proper communications to treat those patients.
Make sure we're not going to surgery when
Yeah.
a more conservative approach would work.
Yeah, mostly the Dr. Crawford, as when we see those Dr. Crawford patient or any other patients, we approach a conservative treatment. When the patient is really need proper treatment, if we consult the doctors before we give any treatment.
What's nice is being in the same building.
Yeah.
You don't find that very often, a
No.
physical therapist and a doctor, and people have to wait, sometimes a week to get
Yeah.
in and get the consult, from the doctor and the physical therapist. Where we're at, you can, like you said, just walk in,
Yes.
down the hall and he's right there, and you can save the patient a lot of time too, because you get 2 for 1.
And just to wrap up here, as far as some of the what it actually looks like for patients who've never gone to physical therapy before and may not have a good understanding of what that is, or may be somewhat fearful of going to physical therapy, can you explain how long a session is and how frequently people would go for something like arthritis, and what sort of exercises and other things they might be doing during a physical therapy treatment?
Yeah, that's a good question. And when patient comes over there, usually they have a severe, especially when they have a lot of high irritabilities. Yeah, so usually we have to be careful on examining those patients. If the patient comes with the severe pain, so we don't do as a full examination, we may have to break it down. And then we explain to this patient what's happening in your musculoskeletal system, so what's happening in your neck. So you lost your motions and it's going to add some more stiffness. So how the therapist, we explain to this patient how the therapist is going to help to decrease your pain. So we use various other modalities to, if you're especially an acute patient, we use a hot pack or cold pack and other passive modality to decrease his pain. But mostly we do hands-on. Mostly a lot of the study recently coming out, we want to do mobilization, we do Mulligan, we do McKenzie techniques. If the patient is appropriate for the technique, we give them, but we explain to these patients, make sure they're comfortable before approaching any treatment.
Right. So, and this is, everybody wants to go towards more technology, more injections, more advanced treatments, but you're saying that a lot of the evidence these days is pointing towards things like manual therapy, actual therapeutic massage, mobilizing the joints, mobilizing the body and getting it moving. And a lot of that goes back to the idea that decreasing inflammation and increasing range of motion is going to lead to the reduction in pain. Is that correct?
Yes, yeah, definitely. When the patient comes, we don't just inject, especially the surgery is the last options. Even if the patient go and see the surgeons, the surgeon will ask you, did you try all these techniques? So there's a lot of treatment option for those cervicogenic pain or low back pain from osteoarthritis, degenerative disc disease. A lot of the studies are, we want them to exercise. Physical therapy is the most important thing to restore this function. We want to educate the patients how the pain works. That's a recent study that shows that it's not what happening to your disc, how the pain works from your spine to your brain. The patient will understand the concept of the pain. Then we explain to them how the exercises is going to help. We tell the patients injection, surgeries are another options, but the surgeries is the last option. So most of the time patient has improved well with the therapy treatment and home program.
I think the message and the takeaway is that pain is not something that you should just live with until you get surgery. It's something that if you're proactive about it and bring on a good therapist and stick to a regimen, and a lot of times you'll send a patient home with home exercises in addition to their therapy that they can use throughout the rest of their life. This is a great way to live with much less pain or no pain at all.
Yes.
I think the best part that I heard from you is that you educate. I don't have to go and say, well, my knee hurts, and then the therapist is treating my ankle. And I had that for 6 weeks. I kept saying my knee was hurting, and they were treating my ankle. And a new person came in, and the last day, and she said, "Are they treating your knee?" And I'm like, "No." And it's because no one explained to me what they were doing. So I like the idea that you go through the whole beginning to end, explaining to the patient, it could be this, but this is what you're going to do for this. And they know that, yeah, the right thing is being treated.
Yes, that's true. That's our goal, to examine the patient as thoroughly, so where is the pain is coming from, what the patient has need.
Yeah.
Even if the patient comes as just a neck, we have to examine whether it's a neck pain is coming from other parts of symptoms. Yes.
Yeah. Well, you might have a new patient next week. We just have a couple minutes left.
Yeah.
Josh, is there any more you want to share that what you guys do at Dr. Crawford's office?
I think we didn't have too many more questions for Tom, but both Dr. Crawford and Tom they prioritize using all of the newest techniques with the traditional techniques.
Yeah.
So I think that's what we're hearing from Tom today, and it's one of the nice things about this practice is any orthopedic condition, from injuries, sports injuries, to fractures, to young children or arthritis. We treat anybody from 3 years old to 90 years old, or more.
Yeah, we've had a couple kids in there today.
Yep.
So
Yeah.
we do treat children.
Yep.
But I just really like the idea. You take the time. And I think that's really important to a patient. You take the time to listen to what their pains are and then talk to them about what they could be or could not be. And that keeps our patients coming back, because we do take the time with them, the doctor and you and all of the staff. We take the time with them. So.
And Dr. Crawford always complains that Tom gets all the credit for his good work. So.
He gets rid of the pain.
We must listen to the patients.
Yes.
The patients come to us. If you don't listen to the patient, we cannot find what is happening with the patients.
Right.
So we have to thoroughly listening to the patients so that we can give them a proper treatment.
And also to put in, we just have a couple seconds left. Tom is in the office bright and early every day, 7 to 7:30, and sometimes he's there till 5, 6 o'clock. Sometimes he comes in on Saturdays. So that's how willing Tom is to work with the patient to get rid of that pain. So Tom, are you doing it at home too? Are you going now into home care, or the hours are wonderful that you work with the patient?
Yeah, I still see patients at the home. If the
Yeah.
patient, especially the hip replacement, knee replacement, if they need a physical therapy treatment at the home, and 2 or 3 days I go and see them after the clinic hours. That's also helpful.
Okay, so thank you guys for being here tonight. I hope everybody starts to understand the arthritis, and you have our number and our website, and please feel free to give the office a call and we'll get you right in. Thank you for being here
Thank you.
tonight.
Thank you.
Everyone, and hope you enjoyed
Thank
the
you.
program.